Good morning, Budi, and welcome to Thailand. It is really my privilege to serve as the moderator for the session that is themed Strengthening the Capacity of Older Peoples to Respond to COVID-19. My name is Andrew Corwin, and I'm on the faculty of Public Health at Thammasat University here in Thailand. We have four excellent speakers representing the region that bring diverse representation from Korea, from Singapore, of course from Thailand, and from Indonesia. And rather than listen to the moderator go on and on, I'd like to introduce our first speaker, Dr. Donghee from South Korea. And we really are privileged to have her here. She's actually a representative of the Aging Consortium of Asia Pacific. She's the Director of Research Institute of Science for Better Living of the Elderly in South Korea. And she is on the faculty of Catholic University in Daegu, and a board member of the Korean Gerontological Society. So let me turn over the session to our first speaker, who we're really privileged to have here. Dr. Donghee, welcome. Yeah.
You mean my face? Okay, sorry. Sawadika, can you hear me? Good morning, everyone. Can you hear me?
We can hear you very well, thank you.
Okay, thank you, Chair. First of all, congratulations, the first international online conference on Thammasat University. I still remember your beautiful campus in Thammasat University. Today, I will talk about the same title, the Strengthen of the People Capacity in Response to COVID in Korean situations. And also I will introduce some innovative programs in Korea. Introduce our research institute is conducting the practical research and incorporating the scientific technology. And then also we are supporting the empowering of the people and some kind of a digital divided, and also get the informations. Shortly, I will introduce about what happened in Korea in COVID. As you know, the December 2019, COVID occurred, and after 4 months, and WHO declared the pandemic. The first case reported January 20, 2020 in Korea, and we just thought just 1 month it would be the finish, but 1 year more, and then now we don't know what happened in future. So most people are very nervous, and then but we are keeping our ordinary life. And depending on the Korean Disease Control and Preventing Agency, March 10th, 2021, our confirmed cases and then 93,733, and the death number was over 1,648. And also this is the respiratory epidemic. The physical distance is very important. So it is very strong, the propagations power, comparing the MERS and the SARS, as you know. Even though we talk about the vaccinations, but still it is impossible to predict when COVID will end it. As the graph showed, we can see the infraction, the point of the 3 stages. And then this is the whole thing is we didn't keep the distance. So this is the 3 infractions. We are the government and everybody noticed the regulations, the distance and the wearing mask. And the COVID-19's infections prevention, control, and the medical response system in Korea, of course, blocking of entry and the early detection of confirmed cases, the response to outbreak, and the treatment of confirmed cases, and then provision of resources, and then treatment of a patient. Now we are talking about the vaccinations. If you ask me what is the best efforts to overcome COVID in Korea, I would like to say the 3 parts. One is social consciousness among people. So our people very be patient and also keep the guideline from government. Also, another one is the digital innovative skill and applications. The third one is the public health system and the contribution of a National Public Health Center. So we call that 3T, testing, tracing, treatment. So this center is systemically well done in Korea. So today, the short time that I cannot show the video, but you can see what we have done the ICT using ICT programs response strategy COVID. So this is also the testing, tracing, treatments applied the whole ICT programs. Also, each of a person, the information of COVID-19 on their cell phone, and confirm the patient also self-diagnose apps, and also our people got the text message from the government, where happened, and then how many patients, and then everything about the COVID information got every people. And also we using the AI robot and the big data, drone, VR, networking equipment, technology applications. And also our government support mental health. And then especially for the confirmed cases, COVID patient and their family, the integrate the mental health support project for the COVID-19 by government. So the different district for the disaster trauma, Yeongnam National Disaster Trauma, Najo National Hospital, and the Gongju National Hospital, Korean Disease Control and the Prevention Agency response on the mental health support program. And ordinary people who are very nervous and then need the mental health services. And then I said before the over 270 the public health center, we call that the community mental health welfare center, the mental health. Also the Korean Counseling Association hotline, the online counseling conducted as psychological support for COVID-19. Vaccination in Korea, we just start. And February 26, we set to begin the mass vaccinations, improve the AstraZeneca vaccine and the Pfizer. And the next month, the improve Aspen vaccine. But starting healthcare worker and the patient, excluding those aged 65 older, at the nursing homes and the other high-risk facility, received the vaccine batch of the vaccinations. We are the survey the attitude about the vaccine in Korea. The 58% confidence the government the vaccination program, but distrust 42%. And also the last month, Korea Society Opinion Institute conducted the 1,020 people over age 18. Do you want to get the vaccine? The other way, the 46%. Watch the situation, 46%, half and half. And watch the situation, refuse vaccination entirely, 5%, not sure, 3%. So still we are the not trust about the vaccination, but there is no choice to get the vaccine. And also now you can see the table here. So the last month, second, there is a compound cases, the majority 50 and the 60, then 20s. So 20s also the many compound cases, but the 20s recovered well, but the older people cannot. So the death rate and the mortality rate is very high in the older people. So they are very divided information, need care, need mental health support, need networking, they need emotional, cognitive, physical activities, and isolated in facility and the hospital. So they are very nervous and they're scared, loneliness. So in hospital and the nursing home, we they set up the window, between window and window, not touch it, not the the touch and touch. So the between window. So the family visited the hospital and then watching all the people, and the nursing home also meet all the people nowadays. And also the community services. We have the 360 welfare center, each of the community. So they are the caring all the people, the delivery meal services, and then the mental health services, and then the counseling services for all the people. From now, I would like to share our research institute programs. We prepared the psychosocial well-being programs after COVID-19 by Elizabeth program. So we developed the teaching aid program. So we support the cognitive and then the emotional and the physical activities. So we are the some of the material, how can using, and then how can expression, how can memory training, how can SOT training. So we delivered these programs in the Jinju City Public Health Centers, and then Dementia Center, and the Busan Yeonje Dementia Center, and then Hadong Primary Health Center, and the Gosong Dementia Health Center, and the Namhae Public Health Center. So they do this kind of programs. Sometimes they made their own paces, and then sometimes in inner mind what they want to do, and then they express this kind of the equipment. So they do the exercise, and then they also the training their thinking and more positive. So this is a very successful program in our research programs. And also we support the Dementia Family Support Program by Zoom. So this equipment training to family, and then family training to the dementia patients. So they do the support or the people not stay without anything. They moving and then they thinking and then they express their thought, their mind, and then so the controlling by Zooms, we are support the family. Then family do the support of all the people. So another ICT programs in our research programs. This is the fundraising by Korean Foundation for the Advancement of Science. And so this is the running how to use of a smartphone, and also empowerment the smartphone using method, and also understanding what kind of a scientific and scientist for later life research and then the programs. So this is focused from the offline to online. So they do the Zoom activities in COVID-19. I will share what kind of programs is that. So you can see all the people come to offline, but some they are how can step by step to go to the online programs. So first time they gathered our center a lot. So you can see disappeared all the people where they go to the Zoom. So at the Zoom we delivered a lot of program about how can using the computer, smartphone, and the Zoom, and also the active aging and better life, and then a lot of material delivered by Zoom. So this is finally all the people move to the Zooms. So this is a very successful Zoom activities project. Okay. And also after that, we upload our web page, and then they are running again and again. So whole material, the upload our website, how can using Zoom and how can using smartphone. So many older people visited our website, and then they continued running this kind of programs. So we survey the t-test the before and the after, what kind of things different. So there is the good result that I will introduce two things. One is the challenge for their life, and tried to the expanding the self-expert skill is much better before. And also the terminology about the digital aging, the concepts, they are not expert, but in the middle stages, they improve a lot. Okay, conclusion. And then change our life because of COVID. So cannot gather over 5 persons. Even in a family, when we go to restaurant, we should separate it, limited per person. And then stay at home, work at home, the online class, online meeting, online conference, Zoom wedding ceremony, and the online party, online tourism, online concert, online shopping, online exercise, everything is the online. But our older people still very vulnerable. So how can bridge digital divide is very important. So we support the continually new digital culture for older people. Also, we gerontologists also accept new normal life in post-COVID in a pandemic. So we must support all the people to be safe and dignified and healthy and active. So this is my conclusion. And then I will mention one, And 2 years ago, the Thammasat delegation visited our center, Professor Kai-san and the Adik-san, and then visited our center. At that time, I knew the historical apprenticeships in Korean War. So I didn't know that before, but the exchange program, historical apprenticeship between the Korea and Thailand. So I really hope this kind of exchange program and then today's international conference is very important to share, challenge, and then making the innovations programs. Kapunka. Thank you so much. 감사합니다.
Professor Dr. Donghee, thank you for the excellent presentation.
Thank you, Andrew.
And we're going to wait till all the speakers have pagi. And I'm going to we'll move very, very quickly so we can listen to the next presentation. Thank you very much.
Good morning, ladies and gentlemen. First of all, I would like to express our gratitude for inviting me to join this very high-level international conference online. First, I would like also to express our great thanks to the President of Thammasat University, the Dean of Faculty of Public Health, the Dean of Faculty of Medicine, and also especially the committee and Professor Carson. Thank you so much. I'm really honored to be here, and this topic is about strengthening older people capacity through 7 dimensions of active aging to respond to COVID-19 is the one that we like to present because this is the holistic approach. And we prepared this topic with our colleagues such as Dwi Indah from Indonesia Ramah Lansia. It's Friendly Indonesia Foundation, Dini Agustin and Taflisi from University of Respati Indonesia. Yulianti Kemal is the one from University of Indonesia. She is the chairperson of retired lecturer, and Lindawati Kusdani is the Dean of Faculty of Dentistry, and Teddy Prastiono is the one from Faculty of Medicine. Yeah. About the COVID-19 cases, by 7 March 2021, we have around 1,368 cases and 37 deaths. And then about the vaccination, from all the for all the people, around 3 million has been vaccinated. And we realized that about the morbidity and mortality prevalence, the prevalence among men tend to be higher compared to women. And if we talk the morbidity and mortality by age group, we found that the death is high. The highest is among the older people, and also the morbidity is the highest among older people. And also we realized that the mortality rates among older people, the 60 plus, is about 19.5. And the Center for Family and Aging Studies have conducted a study. It is online research done by Susiana et al. And 80% of older people were anxiety. And about the coping mechanism, they found that 70% of older people choose to spend time chatting with family. 15%, they would like still to communicate with friends and on social media, and 12% watching TV. Unfortunately, it found that also only 3% do worship with God. And we think that the holistic approach through 7 dimensions of fairness is quite important. So we refer to International Council of Active Aging 2013 that the 7 dimensions of wellness consists of spiritual, intellectual, emotional, physical, social, vocational, and where environmental can be implemented to respond to COVID-19. And because of the spiritual life among the Indonesian people, so fighting Corona, all one in God, is very important. Implementing 7 dimensions, we think that prayer, meditation, and loving others is very essential. And also, we try to advantage of technology, activities, hobbies, and expertise. And also, according to the government policy, have enough rest, telemedicine, and all this important by the community. Digital communication is still very possible. Also, we mobilize the older people to keep reading, writing books, and writing articles, and also doing painting. Social and physical facilities should be improved. So we do implement the seven dimensions of Jakarta. They implemented the 7 dimensions. So the 7 also even praying together, exercise together, and caring others, and also engagement. They also do like learning in the classroom, and also how to still active as a teacher or teaching in the classroom, and also how do they involve to improve the community environment. We also realize that we have to do online elderly schools, and it is one example in Yogyakarta. this class conducted every 2 weeks, 1 to 2 hours. And the participants also are given homework and also they do these activities with their family. Only 40% of participants have mobile phone, but we are lucky because the neighborhood association supported the one who don't have mobile phone. And finally, in December, we do graduation day. 500 of older people graduated, and some of them get awards. And this is supported by the National Board of Population and Family Planning in Yogyakarta. And we will start to implement this in all over Indonesia in 34 provinces. So how about promoting university, age-friendly university? We are lucky because during pandemics of COVID-19, we still can conduct international webinars. We also inviting older people, government policies, policymakers, and also the one who keep in touch with older people association and also the lecturers. Therefore, we conduct 5 series, starting with challenging and then gerontology in general and health perspective. And also we conduct how to mobilize the multidisciplinary and finally involving students. We also do community services for the one who are frail. We do collaboration with health providers. This is the one that we have to present in this conference because the Association of Retired Lecturer Faculty of Dentistry, University of Indonesia should be coming. And they have prepared for last year, and there were around 20 people should come last year, but because of the pandemic of COVID-19, so they try to respond through virtual gathering. In the virtual gathering, so hobbies and talent are presented, and this is also done regularly. We are lucky because all of the retired lecturer of faculty of dentistry are very active in this, such as music, farming, cooking, painting, and also gardening. And also we are lucky because there's also intergenerational and intellectual activities at University of Indonesia. So they do publication. This is one of the example. They write book intergenerationally, professors and younger generation, and also they also preparing the international conference. It's called Asia Pacific Rome University. On the right side, this is geriatric dentistry, University of Indonesia, conducted by Faculty of Dentistry, University of Indonesia. They provide a geriatric service, and also they start to provide like vaccination and other services at the Faculty of Dentistry, University of Indonesia. And we are also lucky because the president and the government supported the vaccination for the elderly, and earlier in the country issued an emergency use authorization for the Sinovac vaccine for the elderly people, and after evaluating data from the second phase clinical trial in China and Brazil. And for the people over 70 years must undergo a screening phase considering the comorbidities. And this is the vaccination app update this is not for the elderly, but for all, that for the phase 1, still 2.3%, and the phase 2 will be 0.71%. It means that it's still a long way to go to improve the coverage of vaccination. We conclude that the highest mortality rate occurred older people is high, and efforts to protect older people to remain active in the COVID-19 pandemic period can be done through 7-dimensional approach. And implementing 7 dimensions of active aging have been done through webinars, community services, book writing, dental services, and etc. And in the new normal, utilization of IT of various activities, including innovation programs and product, continues to be improved. And we are also grateful that the support of government in vaccinating older people is significant. Again, thank you very much for support and collaboration, and also for the ICTUHS family that we still engage virtually and routinely. Thank you so much. Ada suaranya nggak sih sebenarnya selama ini?
Professor Dr. Budi, thank you very, very much for a really informative presentation. I'd like to take this opportunity to encourage our virtual audience to please put your questions forward for the question and answer session at the conclusion of all the presentations. I think that the speakers would very, very much appreciate and take advantage of these questions, and maybe providing clarification and adding to the presentations that they've given. We're now going to turn to Professor Thelma Kay, who is in Singapore, and she's currently an advisor to many international bodies, government and international organizations. And formerly, she was chief of Social Development Division, the United Nations Economic and Social Commission for Asia and the Pacific, and also a former senior advisor to the Ministry of Social and Family Development in Singapore. So I would like to introduce our next speaker, Professor Thelma Kay. Thank you very much.
Okay, here we are. In the beginning. My computer is a bit slow, but all right. Okay, takes a while, but I think we're on the way. You can hear me, I presume, and Andrew. Thank you, Andrew. Yeah.
Yes, we can hear you.
For the very kind introduction. I'm very pleased indeed to join all of you virtually in this very important conference and this panel. Oops. The next one. Sorry. My slideshow seems urgent. Okay. All right. First, let me start with a brief demographic landscape of Singapore. I presume most of you have been to Singapore. We have a very small population, as you can see, 5.69 million, which is just over half of that of Bangkok. Our life expectancy is extremely high. It's almost the highest in the world. And our healthy life expectancy is also quite high, although as you heard from Professor Takeo yesterday, usually the healthy life expectancy is lower than the life expectancy. Right now, we have about 15.2% over 60 years old, but by the year 2030, we will be a super age society. Coming down to living arrangements, which is very important in the context of aging, we are very family centric. So 67% are still living with their family, but we envisage a future problem with increasing numbers of singles or those living alone. Another issue related also to aging is that we have a very high percentage of home ownership, over 90%, which is very good for a place, or if you want to downgrade, or you want to do a reverse mortgage. Now, those of you who have been to Singapore will know that we have many high-rise buildings, and actually we have 90% people living in high-rise buildings, of which about 80% are in public housing. So this is a picture, as you must have seen, in Singapore. So this means that we are very compact and very amenable to community-based services and support. And then one last point on aging, and this is that very small percentage, 0.3 of our elderly older persons are in institutional care, as most prefer to age in place as also their family. Next slide. Okay, let me now turn on to the impact of COVID-19. The number infected as of today is just over 60,000, but of which the majority have recovered. And these are people who were like our migrant workers and also in the community, and very lately imported ones. The number of deaths so far is extremely low. It's only 30. It's very low fertility rate, almost the lowest in the world, of which 95% are over 65. So we have actually a dual track pattern of the impact. One is at the community level, we have very low fertility and infection level. And the high infection levels was actually initially among migrant workers in dormitories, which is now thankfully under control. And the most recent cases are imported cases coming into Singapore from abroad. Usually it's around between 10, just over 10, or even under that. So in other words, in Singapore, we are actually pretty much under control. Now, what is the reason for the successful response to COVID thus far, especially from the health perspective? First of all, we have a multi-ministry task force, so it's very well coordinated, what we call a whole of government approach. And then we learned many lessons from SARS. And then, of course, we have very strict border controls, quarantine, stay-home notice. I think most countries have that. Strict testing, contact tracing, isolation, and also like physical hygiene, face masks, the holy trinity, as they say, the face mask, the hand washing, the physical social distancing, and the crowd limits. So personal responsibility is stressed. But additional to that is that there's very strict enforcement with legal regulations. And every now and then we will read about people being fined, or even foreign workers being deported. Not sorry, I shouldn't say deported, cancellation of their work permits. To avoid our hospital facilities being overstrained, temporary facilities were opened during the height of the pandemic. There's exhibition halls were turned into temporary hospital sites to house the less serious cases. And then when the pandemic was at its height, after the discovery of the many migrant worker cases, there was a partial lockdown called circuit breaker, during which only essential services were in operation. This was to reduce community transmission. And thereafter, after June, there were phased openings, which is still happening now. It's not fully open, probably until we attain herd immunity. And just one last point on the small number of deaths. Some have said that perhaps it can be attributed to the way we classify deaths. For example, if death is caused by other factors other than COVID, then they are not classified as COVID deaths, although this number is actually very small and not very significant. Okay, so what was the impact of COVID-19 on older persons? First of all, like in almost every country, we did shielding, protecting, and cocooning of our older persons. So all our senior activity centers, especially those were like over 68 of them were suspended, and all activities also were suspended, although some of them were then undertaken online. Our older persons were encouraged to stay at home. But this was not mandatory. They were just encouraged to stay at home, although they were then subject to all the Holy Trinity, and if they went out, they could be arrested and fined. And there were cases, many cases of older persons just couldn't stand being at home, and they actually went out, and they were encouraged to return, or in very, very few cases, they were then subjected to some kind of a deterrent. Older persons were separated from visitors, including relatives and non-co-residing grandchildren. So here our many grandparents were very upset because they played very important roles in grandparenting as part of reciprocity. Our nursing homes were also affected. There was heightened infection, not too many, though quickly brought under control with control measures like prevention, testing. No visitors were allowed. Accommodation was in split zones, and there was caregiver management. And then we saw an rise in mental health issues like loneliness, depression, and those with dementia were seen to have deteriorated. However, these measures were compensated and helped by delivery of food and services, especially outpouring of support by the family. You see the picture there. And then we had priority shopping hours, priority shopping hours, priority medical services, subsidized telehealth, etc. So a lot of measures to help older persons. And then there was also customized entertainment for them, customized information, even in their own languages, because in Singapore we are multilingual, multiracial society. So there were many measures to alleviate the severe impact of COVID on older persons. Let me turn on to further health responses. As we all know, right now, the big measure that we're taking is vaccination. And Singapore has been rather far-sighted with regard to vaccination. We're taking a portfolio approach, that is using several vaccines. Thus far, we're using Pfizer, BioNTech, and Moderna, which are being implemented right now. Vaccination is free and voluntary. It started with essential workers, higher risk groups, and older persons. And here with role models, as you see, this is our Prime Minister, Mr. Lee Hsien Loong. And I'm glad to note that the Prime Minister of Thailand was vaccinated yesterday. This coverage will be gradually extended to cover those with what we call multiple touch points. That means those who deal with a lot of other people, such as retail staff, our educators, and you see the age limit is going to be lowered, and also help migrant workers. In Singapore, we like to have campaigns, so there will be a vaccination SG campaign. This is very important because this is to raise awareness of vaccination and to combat vaccine hesitancy and misinformation, because in many countries there are problems with vaccine hesitancy. I mentioned just now about the rise in mental health problems. So we have many, I wouldn't say many, but we have measures. I'm beginning to take more measures. The mental health master plan from the year 2012. In Singapore, we like to have master plans, and this will have action, detailed action on the specific issue. And for COVID-19, we have a mental wellness task force that is going to be transformed into a more permanent interagency platform. And of course, in the latest budget, the finance minister announced a strengthening of the health system through expanding our primary health care and community nursing teams, and expanding the health budget, and very importantly, increasing the pay of health workers. So that is, I think, very welcome news. The next slide is on the economic impact. So although the health aspects have been addressed quite well, it is the economic impact on livelihood and jobs that is causing much concern. I'm sure this is the same in many countries. Our economy contracted by 5.4% last year, and this was in the form of unemployment and income reduction and business closures. So for this, at the government level, there has been 4 relief packages, partially supporting low-income households and businesses that are very much affected, for example, the travel and hospitality and retail. This as part of the funding has come from our national reserves. So some of the very important economic programs instituted has been our one SG United Jobs and Skills Pact, and hiring incentives for local workers. And here it's interesting to note that there is a higher subsidy for workers who are age 40 and above, sometimes even up to 50% of their salaries, because employers are somewhat more reluctant to hire older workers. There's also a jobs growth incentive. This is to create new jobs by co-paying the salary. And again, there is a higher payment for workers age 40 and above. Very interestingly, there's also training in sectors which are in demand. And here, companies like IBM, Shopee, Robotics, Google, Bosch, Siemens are attached. And they provide attachment of full-time training courses with some kind of subsidies for allowances and subsidized fees. We have a lifelong learning scheme called Skills Future. And this, of course, is going to be intensified. And there will be focus on intentional learning and also reskilling and upskilling. Oh, I'm sorry, there is another one. Oh, you can't see. And this is that for those who are unemployed or who are retrenched, there is a aid called COVID-19 support grant. Okay, on to digitalization, of which you have heard so much about from all other speakers. Singapore, we pride ourselves on being a smart nation. So we have, during the pandemic, many measures. Let me just highlight some. We have contact tracing using something called Trace Together, which is in the form of an app, phone, or token here, as you can see in the picture, but there are privacy concerns. So, of course, there's a work from home. So far, 49% are still working from home. And then there's online everything, online learning, shopping, entertainment, gaming, video conferences, and very importantly, digital banking. On telehealth, there has been some advances thanks to COVID. There are more teleconsultation, telemonitoring, and I think there is no move to enable these consultations to be charged against medical insurance. And there's also safe entry digital check-in when you want to go into shopping centers and all that. This is done, I know, in many countries. And some measures that are of particular interest to help older persons is that we have an SG digital office, and there are digital ambassadors to help seniors master that's digital plan for becomes calico seniors, and also financial help for procuring smartphones and mobile plans. Another entry courses for seniors and market vendors. You know, we have a lot of food courts and market vendors in Singapore, and these, especially the older ones, are trained how to adopt QR codes for e-payment. So this has proven to be with some difficulties, but it's coming along. So one positive outcome of COVID-19 is that which provides which gathers together volunteer, donation, and support opportunities. But I think in Singapore, volunteerism needs to be more structured. And here we can learn from Thailand, from Indonesia. There's also community support with many, for example, I'm giving some examples here, physical needs, food bank, this is in the picture, there's a community fridge and also paying it forward. We saw the formation and strengthening of community networks in the form of befrienders and silver ambassadors, meaning focused on older persons. There's also communication engagement through traditional and also digital platform. So we are still using a lot of traditional methods to reach the public, especially older persons. In fact, the government of Singapore is on 10 platforms, including TikTok and Instagram. And the WhatsApp page has 1.2 million subscribers. This is some example. This is from the picture is a screenshot from the WhatsApp page. And also, for those who are not on social media, there's face-to-face outreach program. So it's a combination of the traditional and the digital. I would like to end now on a look at the new normal, that hoping that we can build back better. So first of all, there will definitely be continued health vigilance of mass hand washing this to prevent a new wave and a new variant of the virus, as all of us are aware of this. And as I mentioned just now, our health system will be strengthened, and hopefully there will be more attention to preventive long-term care and also increased healthy life expectancy. And as some of you who must have heard Professor Takeo mention these two important aspects yesterday. Our economy is projected to normalize and to improve with vaccines and the opening and restructuring of national and global economies. There will be a restructuring of the economy into new growth sectors, green plans, smart nation, and of course the challenge is to involve our older persons in the restructuring. There will definitely be accelerated digitalization. I think here the key word is hybrid. There'll be hybrid working, hybrid learning. That means you can do it remotely and also physically. Very importantly, there will be deinstitutionalization, meaning that care will be more community-based and there'll be more aging in place. There will be integrated intergenerational communities, which we already have. If you come to Singapore, you will see some of them that are being implemented, and some doing quite well. And I think we will definitely have to rethink the traditional family support model. COVID also has brought about an enhanced community spirit and cooperation, and this will be strengthened in the spirit of mutuality, interdependence. This is a very good outcome of COVID. And I think lastly, we must not forget the rights of older persons. We must listen more to the voice of older persons. We must fight against age discrimination and ageism. And hopefully they will be making progress towards the Convention on the Rights of Older Persons by the United Nations. So right now, our challenge is to ensure that older persons have the capacity and the resilience to thrive and be mainstreamed into this new normal, hopefully with a new social contract. So are we ready for it? Are we in for it? Let's do it. Thank you very much, ladies and gentlemen.
Thank you, Professor Thelma, for a really excellent presentation. And I loved how you ended it by describing the new norm, which is how maybe we should all be thinking. Again, I would encourage the virtual audience, which now numbers approximately 87, just to provide some context, since we're all looking at our screens and we're not looking around a conference room. The last speaker, actually, we're really privileged to have, and Professor Dr. Weerasak, Putthasri, and please forgive my pronunciation. I am extremely challenged in Thailand in getting any name correct. But we really are privileged. Professor Weerasak is Deputy Secretary General of the National Health Commission in Thailand, and he has experience as Senior Advisor to the Department of Health Workforce with WHO in Geneva, a Senior Researcher of International Health Policy for Health Policy and Systems Research, and on the Faculty of Dentistry at the University of Khon Kaen here in Thailand. And without further ado, we will turn this over to Professor Weerasak. Thank you very much.
Thank you for introductions. You're right, you're correct. My name is Weerasak, yes. Ladies and gentlemen, good morning from Bangkok. When I was invited up to presentations for strengthening the order capacity fighting COVID, why it's important in Thailand. That my presentation will be another story of the order capacity from the previous presentation. Would you please do share my presentation, please? Okay. Why I will.
We're working on it.
Okay, thank you. Next, please. According to the demographic transition of Thailand, this year it is almost 40% of the is 50 years or and above. That's why the elder people is important in Thailand. In some province or the rural communities, the percentage of those is much higher than the country average. Next, please. Next, okay. As we know so far that the older persons is vulnerable for the COVID severities and mortality. Why is that? Because maybe it's from the chronic disease as a hypertension, diabetes is a common underlying condition for the virus severity. In some country, that's why in some country recommend for the older people keep stay at home, like the Singapore just present, wearing masks, washing the hands, and careful of the accidents of the fall, something like that. And also the mental support is mentioned for home care or nursing home. That's why the older persons is prioritized for the vaccination, COVID vaccination in many countries. Next, please. On the other hand, all the older people is burdened or dependent. I don't think so, because it depends how old they are. From the experience of working with the aging society in Thailand, based on the functional capacity, some Thai elderly is active in independence. I mean, the people who with the 60 years of age or something like that. Most of them is active and independent. We can see that the can regularly join the social event and contribute for the social activities. They are therefore they are the assets of Thai or the capital of the communities. So what the capacity strengthening that they need. Next, please. During the COVID outbreaks in Thailand, all people affected from the both illness virus itself and also the social measurement implementation is that curfew, lockdown is not a. We found that there are difficult new job, unemployed, and there are costs of the quality of life. We obviously saw the contribution of the communities to help each other, including the older people in the community as well. Next, please. And what the role of the communities, including the older in the community that contributes. The community volunteers can provide and update the situation and social measure of the government to the communities. And also they can support the implementation of surveillance, contact tracings, home quarantines, and mental support for the people who suffer from the COVID in the community. Next, please. WHO mentions that community volunteer takes important work fighting COVID in Thailand. DG WHO Dr. Tedros also echoed that the application of the whole of the society's approach can curb, reduce the spread of the COVID-19. Trust of the community and health sector is very critical for any emergency response. Next, please. And we just conduct the report, learning from the community in Bangkok, joining with the colleague from the Thammasat University as well. I confirm that the community leader is important for the success. The older people, respected people, or natural leader is also mentioned. Those leadership skills and community trust is built from continuing of the community platform of listening, sharing information, discuss, and find agreement or something that include the traditional and the cultural activity in the community as well. This is important platform of the community empowerment. Next, please. It's a good relations and trust of the community is powerful to support and comply with the government to control. In the older people, the community volunteer can also making the mask. They're making from the clothes, and they made the mask for their community, and some contribute from the community as well. And some community can even donate the PPE or surgical mask to the healthcare facility as well. That's amazing in Thailand from the community empowerment. Next, please. Free of the meals and food, there's something like that is a necessity is provided in the community. In Thai norm of making merit, we call thambun, give and take practice that make it forward, pay it forward is something. It's a practice during the COVID. You may see the cabinet or the cupboard. We contain with the food and anyone can take when needed. Next, please. I myself believe that the people in the community strengthening is the strengthening for the crisis preparedness. We need to keep conducting the culture of the consultation and engagement of the elder with the community. we need not only the individual capacity, but we also collective those community empowerment. We myself working at the National Health Commission Office, we promote the consultation platform by using the local health charter or local health status or the community agreement for their health vision beforehand. From those engagement platform, we prove that it is an effective COVID response in Thailand. My final word of my presentation is that sometimes for the elderly capacities, sometimes we don't need to exclusive strengthenings for the elderly people want, but strengthening the community, empower, inclusive, may be better. That include the elderly in the community. That is for my presentation. Thank you very much.
Professor Weerasak, thank you very, very much. As I remove my mask. Really excellent presentation, and I hope to take advantage of some of the points you brought out during the question and answer session. Again, we're now up to 94 participants, and I'm going to be asking the organizers to put questions from their questions, the audience's questions, to the speakers. And maybe we can begin while they're working to put some of the questions. Oh, okay. The first question that I do on the screen is, what factors make older adults in this COVID-19 era? Professor Kay, if you could respond to that question. Would you like me to repeat the question, Dr. Thelma?
Belum ada yang tanya sama saya, Mas. Muka-muka nggak ada.
Would anyone else in among the?
All right. Okay. I've managed to get myself unmuted. Can you hear me now? Yeah.
Sure. Yes.
Okay. I think one of the reasons for the resilience is I think our older persons took a lot of personal responsibility. They were aware that they had to wear masks, and I think it was more like masking, hand washing, and also a social distance. And as I mentioned just now, actually their lives were very much affected, especially people who during the lockdown, the circuit breaker, because many of our older persons, they had a routine, like they would go to the market in the morning, meet some friends, buy some fruits for the family. So this routine was disrupted. And I think that really affected their well-being, at least their social, their ability to socialize. But they took it very well in stride, because they saw the bigger good that they had to do. And of course, the government was keeping people very well informed. There were like daily updates and also daily advice on what to do. So that was one of the reasons. But even though in my conclusion, I said that we have to rethink the family support model, but I think the family played a big role, especially intergenerational. The younger ones of the family were like teaching the older ones how to use the phone. You know, many of them started using the phone. They were surprised that they could use it. Yeah, that they could do it quite well. So I think it became a period of stronger intergenerational bonding. And also at the community level, as I said, there was big upsurge, young and old, trying to provide food, as you saw in all the slides of my our other presenters too. And also we had like things like ambassadors, they're called ambassadors, meaning like they were out there in the community helping older persons, you know, telling them what to do, teaching, like and those that were, I said, mentioned, wandered out because of sheer loneliness and boredom, they were gently persuaded to go home. So a lot of tender, loving attention was given to older persons to help them to adapt to, and of course in terms of resilience, you know, building digital capacity was extremely important. And also all these resilient packages had something for the family and something for older persons. So I think all these different measures helped in building resilience and capacity to overcome, no, I wouldn't use the word overcome, but to actually cope with COVID.
Thank you, Professor Kay. To give a name to our faceless virtual audience, the next question is from Nanut in Thailand to Dr. Weerasak. I would like the speaker to elaborate more why strengthening community that includes senior is more important than strengthening the senior alone. So the idea that the focus should be on strengthening within the community as opposed to the individual.
Yes, thank you. For Thai situation, I think for the Thai cultures, they respect for the senior one and take care for the senior one at home, and they live together, not the single families. That's why the target person is not for instance, for the information, we don't need to directly information to the elder ones. We can use the target of the younger ones. If the worker persons or the children in the family, they can work, it can work rather than depend on the healthcare worker with the limitation of the number of the limitations. And we believe in the collective empowerment. We believe is that the community can take care their own, have the knowledge, they have the information. Actually, we don't, in the past, we have learned that for the food, for the mask, they can depend on themselves. We just need the information and take care of them. That's why we need empower at the society or the community. That's my response.
Thank you very, very much, Dr. Weerasak. We have some additional questions that are actually not on the board. One being maybe getting back to Dr. Kay's mention of the new norm. But many of the innovations and initiatives taken during the COVID-19 era the idea of supporting these actions during inter-pandemic periods, how critical is that? We kind of ramped up many of our efforts during the pandemic, but what should we be carrying through post-COVID-19 during the interpandemic period and making, in fact, the new norm in reaching older populations in our respective countries. And I'll leave that maybe to, we could begin with Professor Budi.
Yeah. Thank you very much. I think we are lucky because maybe almost every country, especially here in Asia, the government has quite significant policy and also the guidance, and the guidance can be implemented in the community. So based on the guidance, then we just follow the guidance and we implement. This is the implementation should be done according to the condition and the local value in every area. Like in Indonesia, we have 34 provinces and we have various kind of ethnic and various kind of group. Then we implement the guidance based on our specific value and conditions. Is that right?
I have not the answer, but actually Professor Donghee was shaking her head, so I would love to hear from you.
Okay, and without the COVID pandemic, our older people is very isolated in later life. So how can inclusive in a community and how can connecting their ordinary life is very important. So, the COVID pandemic is now happen. So we just think about how can the bridge or the part bridge digital divided, and even now the whole change. That's why do not think about the old model. Just try to the best practice. How can innovative for our older people is very important. Not use the technology. Community changes. Community inclusive, our older people delivery technology. So this is very important. And the other thing is the mental health. Our older people, they have impatient. Also, they have, they had experienced pandemic when they were young. So, the comparing what happened and the watching. Yeah. So we just delivered how can their mind, and then we need some innovative programs to approach for them. So that is very important, our duty among the gerontologists. Thank you.
Thank you, Andre. I think I agree with Donghee. So we also try to do a similar thing in Indonesia. The innovation that created by the population. Thank you.
Next question that we have.
Let me jump in on that question. What should we carry over from the pandemic, post-pandemic? Yeah, I think first of all this attention to health measures, health prevention will have to continue because we don't know when the second or the next wave is coming. So there we cannot let our guard down. So it's good that we will be looking after our own personal hygiene. A lot of sanitation will take place. But I think what is very important is, and is going to definitely continue, is increase accelerated digitalization. There's going to be, as I use the word hybrid, maybe we will move from what we have now into a more hybrid model, because now we have found out it's possible to have online education. I think this will continue. This will definitely continue. So it's so important that our older persons really come up to speed with learning digitalization, being on board with digitalization. Very, very important. And of course, I think this has shown that the need for community, but Dr. Weerasak is very intriguing. Your examples, in Singapore, we are very urban environment, it's full of high rise. So how to get this kind of warm, we used to call it the kampong spirit, the village spirit, how to build vertical villages as it is. I think this is a challenge for us. And as I mentioned, maybe we can learn from Thailand, we can learn from Indonesia, how to build this kind of warm relations with neighborliness and all that, just as in a village, but in a very different kind of very urban environment. Thank you.
Thank you, Thelma, very, very much. There's another question that's been posed by the audience. Do you think community cooperation and participation is required for strengthening the resilience among the elderly? That was seen during the lockdown when the community came together to help them. I'm guessing the older populations in all aspects. And I'll Dr. Weerasak, you had mentioned the community repeatedly, and Thailand has an extraordinary grassroots capacity in servicing populations outside the urban areas, and it's the community healthcare workers. And it is one of those elements that were in place before the pandemic, actually for well over a dozen years, maybe 2 decades, but would you maybe talk as to how they were key in bringing about the kind of access to the older populations and also getting the community as a whole in recognizing the priority of older populations and their susceptibility relative to the COVID-19 pandemic?
I'm not sure about I can answer all the question or not, but for my presentation is focused on the rural, yes, because it's quite obviously see the older people, they live there, they were born there and live there, they have the sense of belonging of the community. It's quite easy to take care of them. In Bangkok, we can see some community in Bangkok, they implement that as well with the small group of the communities. And when I mentioned about the community discussion or engagement, it doesn't mean for in the crisis, because in the crisis they may be can lock down, they cannot catering to discuss. I mean that this capacity is may come from before, is preparedness before the crisis, not only the COVID, but any crisis we can use that. The key is the trust of the community. If you find the leadership in your community is a key success for any crisis. We can do that because if the community is empowered, they can do everything. For Thailand, the character of Thailand that I mentioned earlier, that the older people, they live at home rather than the nursing home. That power of the family and the community is very important. The thing is that we try to keep the older is active, keep active and independent by joining any activity in the community. Is that it is achieve of health. In the definition of health is including the physical health, mental health, social health, and spiritual health. that's I would like to mention about the capacity of the older persons. Thank you.
Thank you, Professor Weerasak. I'm going to also ask the same question to Professor Budi, because Indonesia has an extensive network of health volunteers that organize communities and promote participation in the communities by sectors like older populations.
Thank you very much, moderator. It is very important to discuss, and we are lucky because in Indonesia, actually the integrated community posts for the elderly have been existing in all provinces. And I think the collaboration between government with the community should be done in the grassroots like that. And we are lucky because it's also supported by the policy. So nowadays we have 100,000 integrated community posts for the elderly. Is it okay? Yeah. So nothing.
Yeah, can hear.
Andrew, we cannot hear you.
Can't hear you, Andrew. We can't hear you.
My apologies. One of the real challenges during COVID-19 is maintaining non-COVID-19 to older populations, in maintaining management of diabetes, hypertension, a number of conditions where the prevalence is much higher in older populations. And to the speakers, has this been a challenge, and what kind of innovations have been employed, like telemedicine, to ensure populations that are susceptible are still being managed in terms of non-COVID-19 chronic conditions? Thank you.
Maybe let me go first.
We only have time for one question, so Thelma, please go ahead.
Okay, can you hear me? Can you hear me? Okay, I think on this issue of normal care for older persons, in Singapore, and I think in several other countries, a really large number of cases, and some of them are not a bit mild and asymptomatic. They have set up temporary facilities. Like in our case, we had exhibition halls converted with beds and all that. So this took off the workload from the normal hospitals. Secondly, older persons also had priority attention during this crisis, usually, and so that helped a lot. And also with telehealth, telemonitoring, this can be now charged against social medical insurance, so that helped a lot. And I think you asked about what facilities, what will continue after COVID. So I think some of these new innovative measures will continue. Thank you.
Thank you very much, and thank you to all the speakers during this session. We are now going to proceed to the next session, which will be chaired by Professor Dr. Kay, and we're very, very fortunate. She's been critical in organizing this morning's presentations. It's been a lot of work, and I might add there's some others who are on the sidelines wearing masks, so you wouldn't recognize them even if they show themselves. And we have Kun Porn, and in the back we have Kun Bo, and we really could not have managed this virtual reality without them. So I would just like to acknowledge them. And I'll turn this over to Professor Dr. Kay Son. Thank you very much.
Thank you so much.
Thank you. Bye.
Thank you.